Sir, how do you start to implement Six Sigma in hospitals by using various levels of belts?
Okay. Okay, Six Sigma has got various levels of belts called yellow belt, green, black, then master black belt, then Six Sigma champions. These are the levels of Six Sigma. Okay. So yellow belt means somebody who has got a basic theoretical knowledge of Six Sigma implementation. Green belt is somebody who is involved in a project inside a hospital. Okay, so basically they are involved in a project. Black belts and master black belt, these are the people who supervise the green belts, and they are exclusively involved in Six Sigma program only. But green belt can do their other work, and along with that they can continue the project. Okay. Now the question is, how do you implement this program inside a hospital? So first thing, we have to identify a problem. Okay, or define the problem. Okay, define the problem. After defining the problem, you identify the people who are involved in the problem. Who are the people who are part of the problem? Okay. For example, let us take an example of patient's discharge from the hospital. Let us assume that the problem is the patient is being delayed. There is a delay in discharge. Okay. Let us take a time of 2 hours, and we want our patients to leave the hospital, or the patient should go home at the end of 2 hours. We don't want to delay the patient's discharge. Okay. The problem is a delay in the discharge. Now, who are the people involved in this problem? There may be doctors involved, there may be nurses, there may be billing people, there may be pharmacy people. So these are the players who are involved in this. There may be insurance. Now we have identified the areas which people are involved in this problem. Okay. Now what we do is, we conduct a meeting with all the people in these departments. We conduct meeting with all the people in the department. Okay. Then we measure the problem. First is a define stage. Once we define, then we measure the problem. And from the measurement, we can find out where there is how much delay in each area. Okay. For example, doctors' delay may be 1 hour, nurses' delay may be 1 hour, billing may be half hour, pharmacy may be 1 hour, like that. So when you measure, you find that different areas have different delays. Okay. Once you measure, then you analyze why this delay is happening in each of these areas. Why there is a delay from the doctor's side? Why there is delay from the nurse's side? Why there is delay in the billing? Why there is delay in pharmacy and insurance? We define, measure, analyze. After that, we create a team, and team will then suggest improvement. And who are the members of the team? These people are the members of the team. Not everybody, may be one representation from each department who knows all things in the department. So we create a team of people who will suggest improvement methods by using various tools of Six Sigma. Once they suggest improve, so we have defined, measure, analyze, improve. Then we prepare the control chart. Once we prepare the control chart, then we fix an upper limit and a lower limit, and we plan to discharge all the patients within this chart. This upper limit may be 2 hours, lower limit may be half hour. Okay. So our patient should not stay in the hospital for more than 2 hours. So our aim is to bring all the patients who are like this to inside this chart. Okay. So we have defined the problem, we have measured it, we have analyzed, and now we are having solution for improvement, and then we implement these solutions. And each department, the team member will implement in their area. Doctor will implement in their area, nurse will implement in their area, pharmacy building will take care of their area. So all areas are then allocated. But they will be working as a team. They will be communicating with each other and they will be working as a team. And when they work together, then gradually we can see that this improvement will happen. And whenever there is another problem, again they will meet and they will discuss, then they implement some new methods. And finally, after some time, all the patients will start going within the time. So define, measure, analyze, improve. But the last part we have here is the team. Now, who is going to form the team? The team will be made by, initially by yellow belt people, because they have a theoretical training on Six Sigma. These yellow belt people will implement this thing, they will work on it, and once they achieve success in this project, they can be given a green belt. Means once they when they are successful in implementing this and sustaining this for a period of 3 months, 6 months, then all the members will be given a green belt. So that is how you get promoted to a green belt. Once they have a green belt, they will be constantly doing some other projects. When over a time, when they are very capable of doing all these projects, they can be promoted to a black belt. This black belt will supervise a green belt team. So one hospital can have more than one green belt. There may be green belt in pharmacy area, there may be green belt in building area. So different green belt groups can be there. And a black belt will usually monitor all these groups. So black belt will be entirely into Six Sigma. But green belt people will be doing their job, but they will be also a part of their own projects. Then black belt can go to master black belt and Six Sigma champion, who are totally doing exclusively Six Sigma methods. Okay, you understand?